Hi, this is Hannah Gilliland, and you are watching this if you have volunteered to participate in my First, we need to understand the foundation of an NP's scope of practice. The focus of the nurse practitioner's formal educational program is the foundation that defines an NP's scope of practice. This is a very key point to make note of. Next is the definition of scope of practice. Scope of practice determines who you can see, who you can treat, and under what circumstances or guidance you can provide this care. Scope of practice also determines the limits and privileges of your licensure and certification as an advanced practice registered nurse. I found this to be one of the better definitions offered in the literature. When you boil it down, scope of practice is essentially the who, what, where, when, why, and how of advanced practice registered nursing, and that came from the American Nurses Association. What makes this tricky and often confusing is in the United States, registered nurses do not enter practice with a specialist certification, and their scope of practice is common throughout all regulatory jurisdictions. However, this is not true for the nurse who moves into the advanced practice role of the nurse practitioner. Instead, nurse practitioners enter the profession as specialists, certified to care for populations that fall within their area of certification. Although scope of practice definitions are fairly broad, and you won't necessarily find a list of do's and don'ts, it is essential that we clearly understand our scope of practice and the boundaries and limitations between the specialty certifications. What's key here is specialty certifications. The focused population of care is also known as the specialty area. For this presentation, this would be family practice. It is also important to note that FNP scope of practice is not as broad as our physician colleagues' scope of practice. Questions may arise, well, whose responsibility is it to know, understand, and enforce APRN's scope of practice? First and foremost, the answer is the NP. It would be great if all employers, workplaces, and colleagues understood and enforced the FNP scope of practice. And our goal is to get there in the future. But it's the FNP's responsibility first to explicitly understand scope of practice, limitations, and boundaries, and to enforce these. At some level, obviously, the Montana Board of Nursing must know scope of practice for APRNs as well, since they can discipline those who exceed scope. But the purpose of states' boards of nursing is public safety and protection. Their goal is also patient safety. Next, it is very important for APRNs to understand the terms that the Board of Nursing uses. Let's first address a statute. A statute is a written law that has been passed by a legislative body. Nursing Practice Acts are statutory laws or laws that have been enacted by the legislative body of each state. These acts establish a regulatory agency or board of nursing, one of the duties of which is to generate rules that regulate nursing practice. This leads us to the next portion, which is what is an administrative rule. Administrative rules and regulations that are written by the Board of Nursing are for the purpose of executing the Nurse Practice Act and must legally stay within the boundaries of the Act. The actions of each Board of Nursing must also comply with the State Administrative Procedures Act, which provides the definition for a rule. Usually this is a statement that can be generally applied and that implements, interprets, or prescribes law or policy, or that describes the organization, procedure, or practice of the agency. Rules have the force and effect of law once they have been properly adopted. In reality, statutes, nurse practice acts, and administrative rules are all intertwined, but each has a specific purpose. It should be noted as well that it is easier to change an administrative rule over a statute. I included a screenshot of the Montana Board of Nursing statute and rule information so that you would know where to find it. You will see under the Regulations tab on the left-hand side there are two links that you can click on, Statutes and Administrative Rules. The second screenshot is what you will see once you click on the Administrative Rules link. I highlighted where the administrative rules are for both RNs and APRNs, since you will need to know where to find both. But the focus of this presentation will be on the APRN's administrative rules. And you'll see that that's Chapter 14 and the Registered Nurses is Chapter 12. And I have both of those highlighted for you. An example of a national professional organization is the American Association of Nurse Practitioners. They ensure high-quality health care for all by the patient's provider of choice and help maintain professional accountability within the nurse practitioner profession. The core values of the AANP are integrity, excellence, professionalism, leadership, and service. One of the main services they offer is continuing education hours for NPs of all specialties. I'm going to show you where to locate the approved NPOs from the Montana Board of Nursing website, including the scope of practice documents from the AANP website as well. These documents I'm showing you are fairly broad and vague. The Montana Board of Nursing reasoning is so that they don't restrict the NP's practice. However, I will also be offering you some tips on how to delineate boundaries and limitations so you stay within your scope of practice. I am also going to show you a screenshot of where to find the Family Nurse Practitioner competencies from the Montana Board of Nursing website. Family practice is located on page 9 of this document. So off to the left, the first one that you see, the first screenshot there is from the Montana Board of Nursing under the Resources tab. There's a link called APRN Scopes and Standards. Once you click on this, the white document appears. So this is what the Montana Board of Nursing recognizes for national professional organizations and for APRN scope and standards of practice documents. So this is really important to get yourself familiar with. You'll see that there on the left-hand side, there's the APRN type. So if you go down to Certified Nurse Practitioner, the middle column is the National Professional Organization name and website. The 3 hyperlinks for certified nurse practitioners are provided there. And then off to the right, there's also the documents, title, and date. And you can click on those and they'll take you to the exact document themselves from the website. If you continue to scroll down that white document by the Montana Board of Nursing, you'll come to the actual specialty, and that would be primary care or family practice for the certified nurse practitioner. And off to the right there, you'll find the population-focused nurse practitioner competencies, which I have highlighted down here for you. If you click on that, it's kind of like a PowerPoint presentation, if you will, and family practice competencies start on page 9 of that document. I would encourage you to come on to the Board of Nursing website and click on these hyperlinks, which take you to the correct website. It's helpful to spend some time looking at the documents the Montana Board of Nursing uses for APRN scope of practice. And now you know where to find them if you didn't before. If you want to locate scope of practice documents from the National Professional Organization American Association of Nurse Practitioners website itself, go to aanp.org. If you hover over the tab Publications, you will see the link Position Statements and Papers. You can click on that link, which will take you to the screenshot you are seeing just below. The 3 documents the Montana Board of Nursing uses are highlighted: the Nurse Practitioner Prescriptive Privilege, the Scope of Practice for Nurse Practitioners, and the Standard of Practice for Nurse Practitioners. Although they are fairly broad documents, I would encourage you to read them. They are short. The screenshot at the bottom is taken from the Standards of Practice document, which the Montana Board of Nursing does use, which states it is considered standard of practice for the FNP to participate in health policy activities at the local, state, national, and international levels. I thought it would be helpful to point this out. When you read the prescriptive privilege document, it is recommended that prescriptive authority is solely regulated by the State Board of Nursing, and in this case it would be the Montana Board of Nursing. You can find the administrative rules on prescriptive privileges from the screen that was shown earlier by clicking on the link to the left called Administrative Rules. This is what you will see once you have selected and clicked on the link for the rules for APRNs, which was Chapter 14 that I mentioned earlier. I really would encourage you to go through all the rules that are not repealed from the left-hand side of the screen. Click and read each one. These rules are very important for the APRN to know and explicitly understand. For the sake of time, I will only be focusing on a couple. The Administrative Rule 1464 states that APRNs are not allowed to prescribe controlled substances for self or immediate family members. This is a good rule to spend some time looking at. I have that highlighted for you, and when I'm speaking of a rule, I use the last 4 digits. So in this case, the prescribing practices is 1464. If you click on Administrative Rule 1405, from the left, it is under the APRN's Administrative Rule 1405 that you'll see listed up at the top. It states that APRNs must still adhere to the standards and rules of the RN. And that was from the link. You can find all of those from the link subchapter 12, which I pointed out a few screenshots earlier. I'm continuing to focus on this screenshot at Rule 1405. Section B says, abide by the current practice standards and guidelines established by a national professional organization for the APRN's role and population focus. Section C says, possess the knowledge, judgment, and skill to safely and competently function within the APRN's role and population focus. I'm really emphasizing some key words here that should help you understand scope of practice boundaries and limitations. To recap, the foundation of an NP scope of practice is the NP's formal education program, and that is what defines an NP scope. The scope of an FNP is based upon the didactic and clinical education obtained in the basic FNP program. This rule, 1405, that we're looking at here also states it is the FNP's, APRN's, responsibility to utilize appropriate judgment to determine if a specific role or procedure is within the scope of practice that the FNP has been educationally prepared to provide. It should be noted that regardless of the NP certification, legal regulations do not exist that restrict the setting in which the NP chooses to practice. Rule 1406 from the Montana Board of Nursing states that the APRN licensed in Montana may only practice in the role and population focus in which the APRN has current national certification. So FNPs need to maintain an active national certification. The NP's certification represents their population focus. It is also important to note what one did as an RN no longer counts legally for scope of practice as an APRN. For example, the RN who has worked for, let's say, 10 years in the intensive care unit and goes on to acquire an FNP cannot work in the ICU using the expanded scope of practice of an FNP, but must maintain the scope of practice of an RN. If one wants to work in the ICU as a nurse practitioner, they really should have their acute care certification, or they could be considered working outside their scope of practice. Remember, population is not only defined by diagnosis, gender, and age, but also by acuity and type of care needed. An acute care certification program focuses on the management of patients with complex, acute, critical, and chronic health conditions. So if an FNP wants to work as a hospitalist, unless the patient's acuity and needs meets the primary care focus, they really should hold an acute care certification, or they may be considered practicing outside their scope. Again, this is key. The FNP is not limited by the setting in which they want to practice. For example, a hospital. They can practice in the hospital setting, but the role within that setting must be consistent with the formal education and scope of the FNP's education, certification, and specialty. Your experience as an RN or personal comfort as an FNP are not sound basis for accepting care of an individual outside of your primary care scope. Screenshot of Rule 1469. This whole rule is important, but I'd like to spend a couple moments on Section C. The APRN will maintain an individualized quality assurance plan that is relevant to the APRN's role and population focus, practice setting, and level of experience. This would mean family practice, since that is the population focus of this presentation. FNPs must follow both the National Professional Organizations and the Montana Board of Nursing rules for this maintenance. In case you get audited, it is really important that your documentation shows that you have quality assurance within your population focus. Again, that's family practice for this presentation. Here's a screenshot of Rule 1470. This administrative rule is one of the places that helps us see the two broad categories of nurse practitioner preparation, which is primary care and acute care. We saw from the APRN Competence Development Rule that when an NP maintains and documents competence, it has to be within their National Professional Organization certification and population focus. Since the formal didactic and clinical education the NP receives dictates their scope, it would not be allowed for an FNP to expand their scope to another area without completing a formal education program in that specialty. There is such a thing as overlapping scope of practice between specialties, however. For example, a pediatric nurse practitioner may be qualified to follow some patients into young adulthood before transitioning their care to an adult or family practitioner, overlapping with adult and family practice nurse practitioner scope. And a family nurse practitioner may be qualified to treat common self-limited depression or anxiety, overlapping with psychiatric nurse practitioner scope. But neither is qualified to practice within the full scope of the other specialty area. According to the administrative rule for APRN competence that we have looked at, the FNP may enhance their competencies by learning additional skills and procedures within their scope of practice. Since primary care of infants is within their scope of practice, for example, a pediatric nurse practitioner or a family nurse practitioner could perform a circumcision after obtaining and demonstrating this competency through completion of a formal didactic and clinical instruction course. In contrast, an adult nurse practitioner, even after completion of the same course, could not perform circumcisions because care of infants is outside the scope of an adult nurse practitioner practice. These examples are meant to offer guidance and thinking when one is placed in a situation of overlapping competencies in scope. Two components that the Montana Board of Nursing utilizes are the 2008 APRN Consensus Model and the National Professional Organizations for APRNs that define scope for each type of certification. Per the recommendations from the NCSBN, Montana does not issue temporary licenses for APRNs. When you get a chance, spend some time looking at some of the documents provided here. I've highlighted 3 that I think are a must-read to better understand where Montana Board of Nursing arrives at some of their administrative rules. If you are unsure how to get to the APRN Toolkit webpage, once you are on the NCSBN website, which you can just Google, you can then type in APRN Consensus Model Toolkit into the search box on that NCSBN website, and this web page should appear. So if you scroll down a little bit further down the page is where you'll find these 3 documents that I have highlighted for you, which I do believe are a must-read. I bullet pointed 7 takeaway messages from this presentation that I thought might be helpful for you. They are as follows. The foundation for scope of practice is based on the NP's formal clinical training and didactic education. When in doubt, stop and ask yourself if you were taught the particular skill or procedure as being a part of your formal didactic and clinical education. If there's a certification for what you are wanting to do, get the certification. It's a CYA. Primary care, family nurse practitioners with didactic and clinical education focuses on health promotion, disease prevention, and ongoing treatment of individuals and families. The nurse practitioner can enhance their competencies by learning additional skills and procedures within their scope of practice. You shouldn't expand your scope to a different specialty without completing a basic NP program in that specialty. An FNP may have a role in assisting or directing management of the acute care patient as long as the aspect of care is within the limits of their specialty, role, and certification. An acute exacerbation of a chronic illness could be managed by an FNP if the nature of the person's exacerbation is manageable in an ambulatory setting. I thought you might find these tips a little bit helpful, and that is all I have for you. I hope you have found this presentation beneficial and that you have learned some valid tips alongside clarity about the components that define scope of practice for FNPs. Thank you so much again for your time and participation. I really appreciate it.